For men facing low testosterone, testosterone replacement therapy, or TRT, can be transformative. Traditionally, TRT involved injections, creams, or gels. Now, convenient FDA-approved oral pills like Kyzatrex and Jatenzo offer a user-friendly alternative. The FDA has approved both Kyzatrex and Jatenzo for treating low testosterone. Jatenzo arrived first in 2019, followed by Kyzatrex in 2022. Many see Kyzatrex as an advancement, potentially offering better absorption and more stable testosterone levels. This is key because older oral testosterone carried liver risks. Kyzatrex and Jatenzo are designed to absorb through the lymphatic system, largely bypassing the liver and reducing those earlier safety concerns. How do these pills work? Both raise testosterone levels in men with hypogonadism. Proper diagnosis is crucial. While both are oral, their formulations differ. Jatenzo, testosterone undecanoate capsule, absorbs mainly through the lymphatic system and needs to be taken twice daily with fatty food. Kyzatrex also uses testosterone undecanoate, but is a soft gel with the system to enhance lymphatic absorption. It's also twice daily with food. Food intake, especially fat, is vital for both. Kyzatrex is often considered to be offering more consistent absorption rates. Oral TRT offers significant convenience, eliminating injections and messy gels. This is a relief for many. It also provides more consistent testosterone levels, avoiding the fluctuations of injections, potentially leading to more stable mood and energy. For those with needle anxiety, oral options are a game changer. There's also a suggestion of a lower risk of increased red blood cell count compared to injections due to the more stable hormone levels. Choosing between Kyzatrex and Jatenzo is personal, guided by your doctor. While both are effective, individual responses can vary. Some find Kyzatrex smoother, others do well with Jatenzo. Your doctor can provide the best advice. Ultimately, both represent progress in TRT, offering more men effective, convenient, and needle-free options. While Kyzatrex might have a slight edge in consistency for some, the best choice depends on you. The simplicity and discretion of oral testosterone are making it an increasingly favored option for managing low testosterone.